We spent $59 billion statewide. And so of that astronomical number, $17.2 billion is spent on mass health, $16.6 billion on Medicare, and $3.5 billion on public insurance options, like home health care. That's a heck of a lot of taxpayer money for healthcare. Premiums have steadily increased in the last 5 years, over 12%, without a corresponding increase in access to care or in access to quality. This is a real burden, particularly on middle-income households who don't earn too much to qualify for any assistance, but are still struggling to make ends meet. And they're really bearing the high cost of healthcare. For many families, middle-income families, up to 30% of their income, nearly $20,000. I've seen this in my own family. My family are business owners from the Cape, and small business owners have been trying to do the right thing by providing insurance, health insurance for their employees and their families, but have been left burdened by exorbitant healthcare costs. This is all a big, major challenge, but we don't have to settle for this. Last week, the Massachusetts Senate took a major step towards affordable, accessible, and high-quality healthcare. As I mentioned earlier, by a vote of 35-3, the Senate adopted my amendment, Healthcare is a Right, which charges the state with measuring the impact of the single-payer system of the country on the cost and delivery of healthcare in Massachusetts. And what this amendment does is it empowers the state's healthcare experts to extensively and impartially study the potential benefits and the drawbacks of a single-payer healthcare system. And if the costs, if it is less costly, and we think it is, they have to develop a roadmap to get us there. Representative Garlick talked about the road that's led us here and the work that we have left to do. I really think that having a path forward through the benchmark study really gives us something tangible, because I think we need to be honest that our healthcare system is so absurdly complicated that we could take a vote in this building tomorrow and the governor can sign it to move towards a single payer system, and that is going to take years and years and a whole host of process and time. And so we've got to unwind this system that we have. And so that's really what this single payer benchmark bill does. I'm eager to see this go forward in the Senate, in the House. Rather, if we could do this 35-3, hoping that our colleagues in the House can do the same. And I really want to close and acknowledge how far we've come in the last 5 years. Since Senator Eldridge filed this original amendment in 2012, then it was 15-22. What a difference 5 years makes. That difference is thanks to all of your work. More and more of the people who are getting elected to this building are coming in with a commitment towards exploring and moving towards a single payer system because of the work that you are doing. So please keep it up. We cannot wait. We really have an opportunity here in Massachusetts to lead once again. And I just really thank you for being here, your time, sharing your stories, and all the work that you've done and you will do to move us forward. Thank you.